Yeah, hi everyone. Welcome to my channel. My name is Dr. One, and I am here today to talk about drug routes of administration and their uses. A route of administration is a way that a drug can enter the body. There are many drug routes of administration, each suited to different situations. Each route has its benefits and potential risks. The most common route is through the mouth. Drugs can also enter the body through the skin, gums, veins, nose, and many more. So let's see now what are the drug routes of administration. There are many different drug routes of administration. Some are commonly used while others are rare. Drug administration can be oral, which is when the person swallows a drug, intraocular or into the eye, intraoptic or into the ears, nasal or through the nose, sublingual or under the tongue, buccal between the gums and the mouth cheek, inhale through the respiratory system, enteral, which is when a person receives the drug directly into their digestive tract, rectal or through the rectum, vaginal or through the vagina, transdermal or through the skin, subcutaneous or under the skin, intramuscular or via an injection into a muscle, intravenous or into a vein, intraarterial or into the arteries, intraosseous or into the bone marrow, and the list goes on and on. Now, oral drug administration. Oral drug administration involves a person putting a drug into the mouth and swallowing it. It is one of the most common routes of drug administration, and it is convenient for many as it does not require special equipment. People can use oral administration for a range of medication types such as pills, capsules, and liquids. However, one of the downsides of oral administration is that it can be inefficient. The digestive system and liver start to break down drugs via this route before they reach the bloodstream, meaning the concentration significantly reduces, and this is known as first pass. So essentially what they're saying here is the drug first of all gets to the liver, and part of it is being broken down, and then the drugs start come back into circulation. So that's what they're trying to say here. Additionally, some oral drugs can have adverse effect on the digestive system, and some people have difficulty swallowing the pills. Say, for instance, those who have lower esophageal symptom, that's LES, like older people above 65. Some have trouble setting down tablets and even capsules. So in that case, we need to give them in different formulations, say like injection. That's what they're trying to say here. We have now intravenous and intramuscular administration. The intravenous, known as IV administration route, involves using a needle to inject a drug directly into the vein. The intramuscular route is similar but involves an injection into a muscle instead. IV administration is suitable for many drugs, particularly in situations where a person needs an urgent, high or consistent dose, such as during severe infection. This is because IV drugs bypass the digestive system and take effect quickly. Intramuscular administration also bypasses the digestive system, allowing the body to get a more potent dose of a drug. Some vaccines and hormone drugs have intramuscular administration options. The downside of this method is that they can cause pain, swelling, and irritation around the injection area. For people with needle phobia, they can be distressing. There is also a risk of complications such as infection, nerve injury, hematoma, and accidental puncturing of a blood vessel. Now, let's look at nasal drug administration. The nasal administration route involves spraying or sniffing a drug through the nose, where it quickly absorbs into the bloodstream. This is a route of administration for drugs that works directly on nasal or sinus conditions such as decongestant spray. However, doctor can also prescribe it for other types of medical treatment. For example, some vaccines come in nasal forms. The benefit of administering medication via the nose or that it is painless, delivers a high concentration of the drug and allow drugs to take effect quickly. So essentially you need to understand also how the nose itself is structured. Remember, we have what we call the epithelial cells and the endothelial cells. So those endothelial cells, they are loaded with capillaries, and so it makes blood to circulate faster. That's why the nasal administration is very efficient, thanks to those particular anatomic structures present there. Now, however, only certain drugs works via nasal administration. Additionally, the dose and effect size may have limitation depending on the size and features of person's nasal cavity and how they administer it. People may also make more mistakes with dosing nasal administration, affecting the dose they receive. Another concern is keeping the tips of the applicator clean. If a person does not, they could get recurring infection. The next one is sublingual or buccal administration. The sublingual administration route is when a person places the drug under the tongue, where it absorbs into the blood system or the bloodstream. The buccal administration route works in a similar way, but a person places the drug between the gums and the side of their cheek instead. Both of these routes are typically simple and painless. The drugs absorb quickly, meaning a medication can start working quickly. They can be good alternative to oral administration for people who have difficulty swallowing or with digestion. Sublingual and buccal administration can be difficult if the drug tastes unpleasant. There are also relatively few drugs that are available with this route of administration, and if a person does not allow the drug to dissolve fully, it will affect their dose or dosages. Some people take certain vitamins sublingually. This method can also be useful for delivering immunotherapy for allergies. Buccal administration is the method of delivery for some nicotine replacement product and strong pain medication such as fentanyl. The next one is transdermal and subcutaneous. Transdermal administration is when a drug enters the body through the skin, such as via a cream, gel, ointment, or patch. Subcutaneous administration is when a person uses a needle to inject the drug underneath the outer layer of the skin. Transdermal administration is simple, non-invasive, and painless, uses include nicotine replacement therapy, hormonal medications, and hormonal contraceptives. However, the downside of this route is that transdermal application can irritate the skin, and not all drugs absorb effectively this way. Additionally, the condition of skin may affect absorption. For example, if it is dry or has open cuts, it may absorb too much or too little. Subcutaneous administration is typically for insulin and the anaphylaxis medication known as epinephrine. Because this level of the skin has few blood vessels, this option allows for a slow release of drugs. However, it is invasive and can be painful. The other one we have now is vaginal drug administration. The vaginal administration route involves inserting the drug into the vagina, where it gradually absorbs into the bloodstream. The drug may come in the form of suppository, creams, gels, or capsules. Vaginal administration can be useful for medications that act locally, such as antibiotic or antifungal medication for infections or hormonal treatment for vaginal dryness or atrophy. It is also a route for some systemic drugs that affect the whole body. Vaginally absorbed drugs can be easy to administer and are typically painless, but the drug may cause discomfort if it is solid suppository. A study in 2019 also notes the factors such as vaginal pH, vaginal flora could influence the effectiveness of some drugs. Now, the other route is enteral drug administration. Enteral drug administration refers to any method that delivers a medication into the intestines. This includes oral administration, but also other approaches such as through the nose and into the stomach via the nasogastric tube known as NG. Another option is through the nose into the intestine via the nasointestinal tube known as NI. Another option is through the skin into the stomach via the percutaneous endoscopic gastrostomy known as PEG or PEG tube. Another method of enteral administration is inserting a drug into the rectum, such as via suppository or enema. Each of these methods has its own uses and risks. NG, NI, and PEG tubes can be essential for drug administration in situations where a person cannot eat, as it allows doctors to deliver oral medications directly into the stomach or intestine. Some examples of drugs that can require rectal administration include certain laxatives and diazepam during a seizure. This route can deliver drugs quickly, but can also be uncomfortable, and some drugs may irritate the rectum. Now, I just have to summarize all what has been said before. There are many routes of drugs administration, each with unique benefits and drawbacks that make them suitable for different situations. Doctors will weigh up the best options to prescribe depending on a person's unique circumstances and tolerance. Where one route is not available, it may be possible to prescribe another route for this drug to be administered instead. So far, so good. We've come to the end of it. I hope my student will be happy. For those who have questions, please feel free to ask your questions, and I'm more than happy to help you. Subscribe to my YouTube channel, share the link with others, and ask as many questions as you can. Once more, I'm Dr. Wan, and thank you for listening. Have a wonderful evening. Ciao.